Good morning, everyone. It is so exciting to be with all of you here today. My name's Carol Rattay. I'm from the Division of Public Health, one of the managing partners for Healthy Communities Delaware, and we welcome you to kick off our virtual series about shared stewardship. Our four-part series is designed to energize and inspire collaboration and improve the health, well-being, and equity in Delaware. And together we will explore pathways to identify and celebrate how all of us can play a role in making every place healthy, and how together, very importantly, we can push for long-term investments in our communities. Our audience of nearly 80 people represents community organizations, residents, funders, investors, and other leaders throughout the state. All of you are interested and hopefully committed in exploring how to bring resources together for all communities to thrive. So again, we're really excited to be with all of you here today. It really is a tremendous pleasure and honor for me to get to introduce the next person here, a man with whom I've had the great opportunity to work with and to get to know much better during this pandemic. Governor Carney cares deeply about all Delawareans having opportunities to be healthy and to thrive. And we have seen this in many of his policies. I have seen this firsthand by working with him closely during these past 20 months. Starting with the outbreak at the poultry plants downstate, to acknowledging that testing needed to be easier in some of our harder to reach communities, and ensuring that our Black and Brown neighbors have access to and the knowledge and support they need to protect themselves and others by getting vaccinated. Throughout most of this pandemic, my team and I have had a meeting on our calendars weekly or bi-weekly with the specific title, equity, with the governor. The governor has worked with us to ensure that we are using our data and finding strategies to reach all Delawareans. And because of this concerted effort, we have had some great successes, showing us all that concerted, aligned efforts can make a difference. So without further ado, please join me in welcoming our Governor, John Carney.
Thank you very much, Dr. Rattay, and I apologize for coming to you today on my iPad. I was initially tried to connect through my laptop, which gives you a kind of a better view and gives me an opportunity to see more of the folks that are online, but it didn't want to work this morning. So I'm coming to you through my iPad here in my house on 19th Street in Wilmington. I'm just here really for a moment to underscore how important the work all of you are doing is, to thank you for that work, starting with Dr. Rattay and our folks at the Division of Public Health, who just have been doing an incredible job over the last 20 months, above and beyond, and really stressed out in so many ways, but responding to all the communities across our state, as Dr. Rattay said. And thank you to Stuart Comstock-Gay and Rita. I didn't see Rita, I saw Stuart on. Everybody at UD and the Community Foundation for your leadership with Healthy Communities Delaware. This is really an important effort, and we've learned how important it really is over the last 20 months as we've attempted to address the pandemic, and particularly those vulnerable communities across our state, understanding where those communities are, who they are, who the connection points are. And we've developed so many partners from faith communities to community service organizations to business organizations to fraternities and sororities to our higher education, you name it. Those networks have come up big, and we've have several really good examples of that. We've just faced historic challenges throughout our state over these past 20 months, and I can't say enough about how we've come together as a state. You know, Governor Markell used to refer to Delaware as a state of neighbors. And it certainly is. And I love that terminology, because neighbors care for one another. They know one another. They're connected to one another. And that's what's been key as we've responded to first get people tested, protected, isolated if need be, and then ultimately to get folks vaccinated and to make sure that we're providing access to every community to those life-saving, health-saving vaccinations. And I'll talk a little bit more about that in a minute. But we also learned as our kind of systems and networks came apart, with employment and jobs and food delivery and schools and daycares, because we had to shut so many of those down. We really learned that each of those components were important to having a functioning community and a healthy community. And as I think about my job as governor, job number one has to be making sure that we have good jobs so folks can support themselves and their families, because without that income, without a good job, everything else becomes a lot harder to do in terms of getting healthcare, in terms of housing, in terms of the services folks need, in terms of making sure that their children get to school and they get the education that they need, so desperately need to be successful in life. So for me, it all starts with good jobs, and we've worked hard on that. And of course, as we've had to close down segments of the economy, people are not able to go to work, and so our systems to provide support became more important than ever. When you think about where we are today, as we hopefully are accelerating out of this pandemic situation, we're starting to get over this surge that we've experienced over the last couple months. Sadly, as we've gotten more Delawareans vaccinated, we really have a historic opportunity to provide folks, particularly those who are unemployed or underemployed, with meaningful employment because of the labor market being what it is. If you think about the August numbers nationally, there were 10 million job openings, but only 8.4 million people looking for work. That's good for workers. It's been good for wages, difficult for employers for sure, and the state of Delaware is no exception there. But this is an opportunity for all of us to come together, help those who need skills for the jobs that are available, help create connections for folks that need to go to work. We know that you can't have a healthy community without a healthy economy. And so all of this is really important as we support businesses getting going again and help people go back to work. And you cannot have a healthy economy without a healthy community. And when you think about where we are today, it's really about making sure that we get all Delawareans vaccinated. And we've made pretty good progress with some populations. We met the president's goal of getting 70% of Delawareans, eligible Delawareans, vaccinated by July 4th. We're up to 90% of Delawareans 65 and older who are fully vaccinated. But every kind of sub category under those 65 and older folks, have lower vaccination rates. And our young adults, of course, are the least well vaccinated group at around 55% with at least one dose. And so our efforts need to be turned to making sure that we get every Delawarean vaccinated and safe so that we can stamp down this pandemic and get back to work. We appreciate the work that your partnership has provided over the last 20 months with thousands of deliveries of fresh produce to low-income families in Newcastle County, to connecting nearly 1,500 Spanish and Haitian Creole speaking families to food and housing, to COVID testing and other services. This collaboration has made a difference. And as we think about our successes over the last 20 months, creating those connections within communities is so important. Dr. Rite referred at the top to our efforts in the Hispanic community in the state, where vaccinations and testing initially lagged a little bit. But as we were able to gain confidence working with community organizations and other outreach churches with federally qualified health centers, we were able to create a level of confidence and to take advantage of the social family networks within the Hispanic community in our state, such that the vaccination rates in that community are among the highest in the state. And that's a tribute to all those who have rolled up their sleeves to help without outreach. And it says a lot about the need for what Healthy Communities Delaware is providing and the partnership within all of that. So I want to just end by thanking all of you for the tremendous work that you've done over the last 20 months and the work that you're going to continue to do. We've learned how important a coalition like this is and how important it will continue to be to build healthy, safe, and vibrant communities as we move ahead. So thank you to our sponsors with the Community Foundation, the University of Delaware, all the community organizations who are joining, and of course, Dr. Rattay and her folks at the Division of Public Health.
Thank you so much, Governor. It really means a lot to us to have you here with us today. Now it is my great pleasure to get to introduce Rita Landgraf. Rita is the director of the University of Delaware Partnership for Healthy Communities and a managing partner of Healthy Communities Delaware. Prior to joining the faculty at UD, she served as cabinet secretary of the Delaware Department of Health and Social Services, where she led the principal agency charged with keeping Delawareans healthy. Rita loves the opportunity to reinvent herself, and being at the UD provides her a vehicle to continue to do what she loves in working with communities, but also fulfilling her passion to do teaching. Please join me in welcoming Rita Landgraf.
Thank you, Carol. It's a real honor to be here and an honor to actually be one of the managing partners for Healthy Communities Delaware. And we finally call ourselves HCD, so I'm going to refer to us as HCD. The governor highlighted what our vision is: healthy, safe, vibrant communities where all people are thriving. And when you think about that word thriving, it really does convey a commitment to create communities where all people have a fair, equitable chance to participate, to prosper, and to reach their full potential. Now, our stated goal is to improve health, well-being, and equity in Delaware communities through this alignment, investment, and to create an impact. One example of this alignment is, of course, all of you, a network of partners, and also through this unique structure of management, which is inclusive of, and you heard the governor state this as well, of the Delaware Division of Public Health, the University of Delaware's Partnership for Healthy Communities, and the Delaware Community Foundation. Now, we've created guiding principles, which we embrace, which always guides the work at HCD. And in order to create these healthy, safe, and vibrant communities, we must collaborate in concert with the communities themselves, specifically focused on understanding and accelerating resident-driven priorities around vital conditions or social determinants of health. We embed equity in everything that we do. That is most importantly at HCD's core. We mobilize across sectors. We understand and we embrace that we must increase prosperity in these communities to improve overall health and well-being, and that we must commit to investing over the long term to see this meaningful change. Now, our goals for today's summit are to share some of the successes of our Healthy Communities Delaware partners, to share examples and the value of what we're calling shared stewardship outside of our Delaware communities, to share opportunities to enhance this work through this shared intention of stewardship, and to invite your ongoing participation and alignment for shared stewardship. So what is a steward? It is individuals or organizations who take responsibility and commit to working with others, focused on the conditions that all of us need to thrive, beginning with those who are in communities that are struggling and suffering. May be affiliated with an organization, or stewards may act on their own, like a community resident. In fact, we want community residents at the table in this shared process. Stewards have or are interested in developing an equity orientation regarding purpose, power, and wealth. This is our opportunity to come together and collectively to prioritize our investments and working on the vital conditions or the social determinants of health. As you know, working on vital conditions will not just happen overnight. It happens over the long term and will require sustained alignment and investments. This is not considered a project. It is a commitment to a culture change, an opportunity to enhance how we work together over the long term. Thank you for joining us today. I now have the honor to turn it back to Dr. Carol Rattay, and I just want to give you an understanding of who Carol is, although all of you in the room actually know Carol. She currently is our director of the Delaware Division of Public Health, and as you know, a managing director of our Healthy Communities Delaware. She is a board certified pediatrician and also expert in preventive medicine. And prior to her appointment, she worked at our Nemours Health and Prevention Services. And she served as a senior public health advisor to the Surgeon General. She loves raising her children in Delaware and running on our beautiful trails. Without further ado, I turn you back to Dr. Carol Rattay.
Thank you so much, Rita. Again, really excited to have all of you join us today. I am going to touch on a few basic points that are likely not super new to most involved in this conversation, but I will include a couple of updates in our thinking. So really to ground us in Healthy Communities Delaware as being a place-based approach, we have known for quite some time that there are factors beyond just access to healthcare services that are critical for our health, for our having opportunities to be healthy. And while we have amazing healthcare systems in the state of Delaware, we know we can't just medicalize ourselves out of these tremendous disparities we see. In other words, we really have to address some of these socioeconomic factors like education, job status, family social support, income, community safety, as well as our overall physical environment, if we really want to drive healthier behaviors and healthier outcomes and see Delawareans have equal opportunities to thrive. To really put a finer point on this on the next slide, and I think many of you have seen this, but we see such a stark difference in life expectancy when we look at different zip codes across the state of Delaware. So in some of our areas where we have a longer life expectancy, you see a life expectancy being about 86 years, but in some zip codes, that difference is 18 years lower. And we know that some of these social, economic, and environmental, physical environmental factors are really what's driving these significant differences that we see across our state. So Healthy Communities Delaware really is, as we know, place-based, but it's about aligning in these places, in these neighborhoods, It's a cross-sector collaboration to address complex issues within defined geographic areas. So using data to understand the challenges and the assets in each neighborhood is critical. And as Rita mentioned in our guiding principles, communities are really um, critical citizens, leaders in communities are critical for driving these changes, for planning the changes, for defining the priorities, and for leading the change. So Healthy Communities Delaware is really based on supporting communities, community leaders to be able to make these changes. And very, very importantly, as we've seen many times in the past, short-term investments aren't what is needed. What is really critical is long-term investments in these communities. So how do we define these communities? Um, and for those of you who have been with us for several years, you saw that we created an opportunity index here. Based on really health outcomes. But we're really happy to see a more standard approach come from the Centers for Disease Control and Prevention called the Social Vulnerability Index, which goes a little bit more upstream, looking at measures like household composition, race, ethnicity, languages spoken, socioeconomic status, housing, transportation, etc., more focused on the vital conditions or the social determinants of health that we know that are driving many of the differences we see in health outcomes. And so you'll see us using that more and more. We've used it a lot with COVID. We have it on My Healthy Community. So you can see how the social vulnerability index looks different across geographic areas in our state, but it really is, we feel, an important index to help us identify what are the neighborhoods, what are the areas of our state that need these more concerted, aligned efforts and long-term investments. So finally, I just want to kind of have us regroup a little bit. We've talked about social determinants of health really from the beginning. We're starting to pivot, like many national partners, on a concept called vital conditions. Vital conditions are a little bit less health specific, but we know critical for communities and individuals and communities to be able to thrive. Vital conditions are properties of places and institutions that we all need to be able to reach our full potential, like food and humane housing and access to meaningful work and wealth and a sense of belonging. So I'm going to ask you all a question. We're going to take a poll for a moment, but if you can go back to that one slide, let me touch a little bit more on each of these the vital conditions. So thriving in a natural world is about sustainable resources in our communities. Do we have the ability to make contact with nature, freedom from hazards? It has an environmental focus. Basic needs for health and safety. Do we have access to healthy foods? Do we have access to safe physical activity? Do we have freedom from trauma and violence? Do people have access to health care? So that's what basic needs for health and safety focuses on. Humane housing. Do people have access to affordable and safe housing that's close to work, school, recreation, and nature? Meaningful work and wealth is about, do individuals have access to good paying and fulfilling jobs, and family and community wealth? Learning is, I think self-explanatory, but whether it's, beginning from birth all the way through lifelong learning with our K through 12 and institutes of higher education in between, do individuals have access to meaningful education? Transportation. Do individuals have access to reliable, safe, and accessible transportation? And then finally, and I think we're learning this even more and more important, belonging and civic muscle. Do people have a sense of belonging and the power to shape a common world social support, opportunities for civic engagement, vibrant arts, culture, and spiritual life. So again, these are the vital conditions, and we would love to hear from all of you. Which of these vital conditions do you work to improve? And this could be either through community-based work, through volunteer work, or through funding. Do you make investments in these areas? And you can check one, you can check up to your top 3, but we would love to hear from you what areas you are focused on. So at this point, if you can go ahead and submit your top 3, that would be wonderful. But at this point, it looks like I can't see how many people have responded, but you can see it from this poll that about 72% of participants are focused on basic needs for health and safety. So that's the highest, but we also have a lot of folks who are focused on humane housing, as well as education and learning. Belonging and civic muscle also, I think that ranks 4th. And additionally, we've got meaningful work and wealth. 34% of you are focused, not as much on transportation and the thriving natural world. But it's really great to get a sense of the focus of individuals on part of the summit today. So with that, I am going to hand it over to Stu. It is my pleasure to get to introduce Stuart Comstock-Gay, who is just such a joy to work with and to get to know. Stu is going to talk more about aligning investment for greater impact. Stu is the president and CEO of the Delaware Community Foundation, as well as a managing partner of Healthy Communities Delaware. He has spent his entire career addressing issues of community, democracy, and civil rights, both in philanthropy and civil rights work. Before joining Delaware Community Foundation, he served as president and CEO of the Vermont Community Foundation and spent 7 years in various leadership positions at the New Hampshire Charitable Foundation. Please join me in welcoming Stuart Comstock-Gay.
Thanks, Carol. Part of the reason I think Carol and I like each other is we're both from Ohio originally, so we got that thing going on. I do want to say, I hope you all know this. I mean, this is a really different project, and not like a lot of you, I have my national networks too. And when I meet with community foundations around the country, social determinants of health come up in a lot of ways, but there isn't another place that has the kind of leadership and willingness to put itself out there on this structure, this long-term support for community voice and community agency. And that has to do with the governor, has to do with the administration, has to do with the Department of Health, has to do with a lot of things, but part of that is that we have Carol Rattay here, and we're very fortunate in that. So thank you, Carol. I want to talk a little bit about funder collaboratives. My colleagues here, and there are a lot of great colleagues here, Tanetta from Philanthropy Delaware, Chris Grudner, Maria from Longwood, a lot of other folks. We all know this. This is a discussion we're having, we're participating in, but there are a few things I want to say about this that will be both repetitive for some, but also newer for some. And it's that this discussion about how funders work together is absolutely happening across the country and in Delaware. It's been true for a long time, but it's getting deeper, and that we're recognizing, and criticism of philanthropy and government funding and all that is coming in about, hey, the way you've been doing it doesn't always work, particularly for smaller organizations, particularly for real community level organizations. And I think we're paying attention. Also paying attention to the fact that short-term transactional investments are not enabling the high impact returns that we all want to see. It's only so good. You fund something for a year or two and say, well, that's great. And oftentimes it's wonderful. but we really need to go deep. And the truth is, when Carol came in and Steve Paquet, before this got started, they said, hey, would you want to participate in this? And the discussion we had was this project needs to be very inclusive and needs to be a commitment for 10 to 20 years. And that, because that's the kind, it's generational work. It's not work of a year or two. So that's what's interesting in this. The work of this for those who can provide financial resources particularly is how to align, both align to co-funding, but also align towards side-by-side partner type funding. And there are a lot of different examples about that. These social determinants of health, vital conditions model is a framework that can work in lots of our different funding. You know, it's kind of, this is an exaggeration, I don't want to belittle it, but it's kind of, it'll cure what ails you. If we can get at social determinants and vital conditions, it's going to address so many of the other things we all care about. Whichever of those 6 or 7 indicators you all check, we can get at this, it's going to change things all across the board. So coordinating funding, co-investing in existing initiatives are examples, and I'll come back to this in a moment or two. So benefits, I'm not going to read all of these, but there are benefits both to grantees, but also to funders, because one of the things is changing the imbalance. Just because one group of partners here has the cash, one of the things I say, you know, I've been in foundations, I've been out of foundations, I've been asking for money, I've been pleading for money, I've been providing money. It's just different roles. And there's a power imbalance too often, but for funders, we can't do anything unless community groups say, this is what we need to do and how we need to do it. And so that's part of the message in this co-funding. So the benefits are significant to both funders and to grantees. One example of this, and I just put it up as a very recent example because most of you have been involved in this in some way or another, is the COVID-19 package of funds that we were part of. The Strategic Response Fund that I mentioned here, we launched it in March 18th last year. So just as this was hitting, as a partnership from the get-go between Philanthropy Delaware and DCF, and also United Way of Delaware and the Delaware Alliance for Nonprofits. And we created a couple funds, one here, and then United Way also had a fund. Raised about $2.5 million in the first week, $1 million of that from Longwood, and then additional monies were put in by Longwood and other people, but 350 or so donors, many foundations, many businesses, many collaboratives, some government agencies, all saying, hey, if we do this together, we're going to be able to have more impact. And in the fund, and look, the United Way Fund was doing the work it was doing, and a lot of other people, Restaurant Association, other people were putting together their own funds. It was a broad speaking alignment, but it presented a real opportunity to think differently about our work. What I think is really interesting about it is, one, the community needs grants. What we say here is a 4.3 million to 200 some organizations statewide. There were about 50 different people participating in reviewing and processing those things. It was, and nobody got, none of the people doing the work were getting paid for that work. I mean, yes, those of us who work for funders were getting paid by our regular jobs, but the money came in and every penny went back out the door in one way or another. But over 50 people volunteered or were assigned or said, yes, I'll take off my regular job to do this work to get those dollars out the door. And in the second pool, and some of you participated in this, which was vision grants, to say, hey, the world's going to be different. What can we do to help organizations pursue their big ideas? And while that piece of the fund only put out $700,000, it leveraged another $2.5 million from foundations, businesses, others who said, that's a cool idea, that's an important idea. We understand your fund will put in $100,000. We will put in another 500, 700, whatever else it is. And so it became both a collaborative, purely collaborative funding where we made collective decision project, but also a side-by-side funding thing. And that's part of the message on this, is that there are a lot of ways to do it and it's not controlled by one entity. And we have to be willing to let go a little bit of the decisions in the favor of more collective decision-making. And I want to say two more things about this. We have a moment here. So yes, this project is working in this way. Other folks, Philanthropy Delaware, others are saying, well, how can we build more of this? It's certainly something in 20 some years in foundations. It's a piece of work I've been trying to get at for a long time. So that is real. And the clamoring is, how do you work together? But we also have the lessons of COVID right now, both in how we see what it's like when we work together toward a crisis. And it kind of sharpens your focus when you have something like this. And some of you have been involved in other disasters, flooding, hurricanes, fires, whatever. It certainly sharpens your focus. But so we have learned that. And we've also seen, we've stripped bare some of the biggest problems in society about opportunity and racism and equity and needs. And we should have a lesson which says, okay, what we were doing wasn't quite working. We need to be doing this together. So I think the timing of Healthy Communities of Delaware, the timing of COVID, everything has conspired to come together and say, this is the time to be thinking differently about our work. This is the time for us to be working together, if not now, when? And that's why I find this all very exciting. So one of the things I'll say, as we have these discussions, for those of you who are able to bring additional resources, I mean, yes, absolutely the resources about what you're doing on the ground, you're organizing, you're collaborating with people, but also your agencies, your healthcare institutions, your foundations, to say, how do we align our thinking on this? And again, a lot of people are doing this, but we need to keep pushing on it. How do we align so we're side-by-side funding toward common goals, or we're putting pools of money together? We've got a Healthy Communities of Delaware fund that is based at the Community Foundation. There are some people who are already putting some resources into there so that the leadership of Healthy Communities, led by Kate, and we'll get to her in just a moment, will be able to move this money toward the community-based groups in a collective way. So I'm excited about this project, as you might be able to tell. I'm thrilled to be working with my colleagues on this thing, and I think that we're really going to be able to accomplish something. And with that, it's my opportunity to introduce Kate DuPont Phillips. We hired Kate as our first staff person, gosh, 2 years ago now, my goodness gracious. And Kate has done, I think, a bang-up job of organizing these many tendrils of commitment toward a better Delaware and toward strengthening communities that have the greatest challenges and trying to help with alignment. And so with that, I am going to turn it over to Kate DuPont Phillips.
Thanks, Stu. I appreciate it. And it's a really amazing project. I'm so fortunate to have the opportunity to work with so many amazing community partners and network partners. So I'm going to share some of the highlights of the great work that our Healthy Communities Delaware partners have achieved over the course of a year from May 2020 through June 2021. And these achievements have been realized both due to significant investment in vital conditions or social determinants of health, as well as much of the hard work on the ground by community-based partners. So the state of Delaware invested $1.4 million from May 2020 to June 2021, and has committed $1 million per year ongoing to accelerate resident-driven priorities for thriving communities. In addition to the state's investment, over $5 million in funding was aligned or leveraged, increasing the impact of the work toward thriving people and places. Here you'll see some Healthy Communities Delaware partners in Newcastle County and the city of Wilmington, and they're listed by neighborhood. Most communities have more than one organization. They're working together toward place-based goals that are outlined in a community plan. And while most are focused at the neighborhood level, the Latin American Community Center serves the Spanish-speaking population across all of Newcastle County. Here are our community-based partners in Kent and Sussex counties. Again, they're mostly focused on place-based initiatives, with La Esperanza covering multiple areas of Sussex County. And these are just a few of the many accomplishments of our community partners really over the course of just 1 year. The beginning of this timeframe coincided with the emergence of COVID. So you'll see that the work covered both urgent needs related to the pandemic, as well as longer term work on community vital conditions. 6 community needs assessments and action plans explored both challenges and assets of communities, with residents prioritizing areas of action they felt were the most important. You can see that the kinds of work varied from provision of laptops for student learning to affordable housing development to community revitalization services to healthy food access. And where is all of this leading? Each of those individual outputs is contributing to the journey toward creating the vital conditions for thriving people and places. So community-based collaborations are working, we know, year after year to enable this meaningful change at the neighborhood level. And this is long-term work that requires sustained funding. These are examples of concrete projects that currently need investment right now. Affordable housing development is occurring on the west side, east side, and in Southbridge, Wilmington. Home assessment and repair is occurring in Ellendale. Restoration of a landmark building as a community hub is in progress on the east side of Wilmington, as well as a new effort to provide back office support for minority builders. Beautification initiatives are taking place in the east side and the west side of Wilmington. Park revitalization efforts are underway in west side and Southbridge. Youth activities have been identified by nearly every community as needed and critical supports for the well-being of young residents. Community gardens and vacant lot maintenance are a priority across the city of Wilmington and in Route 9. And really essential for all of this work to happen is the long-term stability of staff to steward these and other community priorities. So collaborative funding on these concrete projects is one step we can take together right now. We'll follow up with some of you after this meeting and hope that you will join us in funding some of these and other projects. And to get different results, we also have to think and act differently over the long term to address the systems challenges that hold big problems in place. How can we invest together in this work over the long term to enable meaningful change, to shift from transactional collaboration on one project at a time to transformational work in which we are all stewards of a shared vision for thriving people and places. This is the work that we're going to be exploring together through the Shared Stewardship series. And it's really exciting to know that we're not alone in this work. We're part of a national movement for thriving together.